My father was a huge influence on me because he thought a lot about ethics and philosophy and how to live. And, he really said your job is to make the world better. Your job is to be, the whole purpose in life is to be kind to people and to make the world better. And I think that's been a driving force for me. It makes me feel like I'm contributing, and it kind of has helped clarify my thinking. And this is what I should be doing. I was born in Toledo, Ohio, and I grew up there, went to school through there, and then I decided to come to the University of Michigan. So I came here for college, and it's such a great place that I stayed the rest of my life here in Ann Arbor. And I did some internships during my college years, which were also very, very meaningful to me. I think my second year internship was hugely formative. It was a program on the war on poverty, and I went to Guthrie, Oklahoma on a Job Corps program, which was to take girls from super poor communities age 16 to 19 and help them get the GED and give them vocational training. And these were people I had never met before. They were from the Mississippi Delta, Hispanic kids from Texas, Appalachian kids from Kentucky. I'd never done that kind of diverse stuff before, and it was just fascinating. I loved it, and that's what made me decide to become a social worker. When I graduated undergraduate, I went directly into social work school, and I got my master's in social work here. So for the first 7 years of my career, I worked in a Wayne County psychiatric hospital, and I did that. It was not suited to me. I quit the psychiatric hospital when I had my first child, and I thought that I would want to stay home. I was thrilled to be a mother, and I loved it for about a year, and then I started getting a little nutty and bored, and so then the transition into doing a totally different job, community development, and it was 12 hours a week. It was perfect because I could be home a lot, but I still had a kind of professional adult thing I was doing. I had the opportunity for a job to develop a senior center in Whitmore Lake. It was called a senior nutrition program, which still exists. They serve lunch 3 days a week. So I was hired to do that, and I really loved the whole community development part. I did that for 7 years, and the time was great because I still really did love being a mother. I got tired of doing recreational activities, bingo and Christmas parties and stuff. I got tired of that part. I was into the more social work kind of stuff. So then I got my main job that I did for 23 years, which was very exciting. It's called the Medicare Medicaid Assistance Program. It was a perfect job for me. It was public policy. I had to learn all the complicated rules of a federal law. I got to work with amazing volunteers and trained volunteers. And I was out in the community a whole lot, educating the community on healthcare, how to access healthcare, how to help them navigate this very, very complicated system. So just developing a new program with no resources, it was all me, part-time, doing this massive job. But that's kind of social work. So I kind of built that program up. It was a pilot program in Washtenaw, which was really exciting. And then it went over the state, and now it's a federally funded program. It's called SHIP, State Health Insurance Program. So it exists nationwide using volunteers, and it's still in Washtenaw County. I still work with some of the people as a volunteer who were in that program. It's still just a great program. So I just feel very proud. That kind of feels like my baby in the county. After that, I worked 10 years for the university as assistant director at the Turner Senior Resource Center, which is part of the geriatrics program at U of M. It was similar. I did a little bit different kind of stuff. It wasn't so finding healthcare focused, but it was similar in terms of helping people resolve problems in kind of an advocate role. It was a new position, and I kind of melded it to fit my experience and stuff I like doing. I still volunteer there, and I still really like it. To do volunteer work, to get out in the community, to see that there's really a big world out there, and you learn so much from it. There's so many ways to go. I guess the older I get, I feel less like there's one right way to do it. So there's a lot of things out there that people can do and explore. And I think the more people can do, the more varieties of people they can meet and experiences they can have, that will help shape people into finding something that works for them. But that takes time and it takes a willingness to do things out of your comfort level. A lot of it's just meeting the most interesting people. Really like working with older people because I was a history major in college, and you just hear people's life histories, which has always fascinated me. I've met really, really wonderfully interesting people. That's a big thing. So if you talk to different people, get to know older adults on a personal level, you'll learn a lot, and it will come back to enrich your life. Now that's me. I thrive on having a lot of connections with people. Yeah, it's weird summing up a whole life.